So am I sharing my screen? No, now I'm sharing my screen. There we go. Okay. Okay, thank you everybody. Thank you for joining me. I'm going to go through this presentation. We're going to talk about our medical, dental, vision plans. Feel free to ask any questions that you have while we're doing the presentation. If you don't have questions now, but at the end of the presentation, I will stay on the call and answer any questions that you have. Of course, if you've got questions that you want to take on to a one-on-one basis, I'm more than happy to help you with that as well. So we'll talk about our employee benefits program that starts December 1st. My name is Bill Hammett. I am honored to be your insurance broker, your insurance expert. You can lean on me throughout the year for questions about understanding your health plan, understanding how it should work, picking the best health plan for you. Also available is Anna and Araceli. They are assigned to your account. So throughout the year, if you've lost an ID card, if you need to find a new doctor, if you need to understand how something should be covered, if a claim has been denied, we're here for you, not just now, but throughout the whole year. So we're here to help. So please lean on us should you need us for any reason. Our quick agenda, we'll talk about the timeline of open enrollment. We'll talk about the medical plans, the dental vision plans. We'll talk very briefly about how do we enroll. It's that same enrollment portal we did before. And then any questions you have, like I said, I'll stay on this call for as long as there are questions. So our open enrollment deadline, we do a week open enrollment. It starts today, October 7th. It goes to Tuesday, October 14th. If there's something going on in your life that requires you a little bit more time, don't worry about it all. Just let Gwen know, let myself know. We'll give you the time you need to make a good decision for you and your family. This is the time where you are all eligible to change plans, to decline your coverage, to enroll for the first time, maybe. Maybe you didn't add the dental or vision plan, but now you want the plan. You can do that now. Maybe you want to add a dependent or add a child, someone. This is your free time to do anything that you want throughout to your plan elections. Any changes that you make. So if you log in right now and add the dental plan, the changes you make in this open enrollment period will be effective on December 1st. Okay. We're starting early because insurance companies take a very long time to do everything. So we're starting nice and early so that there's plenty of time to get all of you into the system so that on December 1st, any elections or changes you made are in place. We're asking that everybody have this done no later than Tuesday, October 14th. If you have problem, again, if there's any reason why you need more time, you just let Gwen know. She'll let us know, and we can help you through that process. So we have 5 medical plans available. There's 2 silver plans that are the benefits are exactly the same. One is in the Performance Network, one is in the Premier Network. We're going to talk about what that means in just a second. Then we have 2 gold plans. Again, one Performance Network, one Premier Network, and then we've got a Platinum HMO net plan through the Performance Network. Now, these plans are exactly what you think. Silver is going to be the lowest cost plan, but it's going to ask you to pay the most out of your pocket when you go to a doctor or go to a hospital. Gold will cost more per paycheck, but you'll pay less out of your pocket when you go see a doctor or go to the hospital. And the platinum plan will be the most expensive, but it's the very best benefits. So, speaking of the network, so we got the Premier and the Performance Network. And the Premier Network is really basically Sharp Steely and Sharp Community Medical Groups. All right. So this is still a very large network. So if you're seeing a Sharp Steely doctor or a Sharp Community Medical Group doctor, you are in the Premier Network and you're good to go. The Performance Network includes the Sharp Steely and the Sharp Community Networks. It includes everything in Premier, but it also has Rady's Children's Health Network, Children's Physicians Medical Group. And for those of you in the North County and Northeast County, Vista, Poway, San Marcos, that area, the Arch Medical Group and the Graybill Medical Group, as well as Sharp Community Inland North. So the Performance Network is really great for those of you either with children enrolled on the policy or if you're kind of in the North County inland area. So if you divide San Diego into kind of 4 parts, that top right corner. So like I said, Poway, Rancho Bernardo, Vista, San Marcos, Escondido, that area up there has got better coverage of the Performance Network. If you're kind of in the middle of the county, if you go to Sharp Reese Dealey or you go to Sharp Community, you are good to go with the Premier network. But if you got kids or live inland north, I really want to encourage you to think about that Performance network. So here's a slide that for those of you in the conference room, it might be a little bit hard. I see people leaning forward already. Again, this will be a good time if you want to review this recorded presentation to see this better, or if any of you just want to see this document side by side, I'm happy to share it with you. So on the far left, we have our two silver plans, the Performance and the Premier plan. In the middle, we have our two gold plans, Performance and Premier, and then we have our Sharp Platinum plan. The silver plans have the exact same benefits as one another. It's just a matter of the doctor network. Okay, so when you're looking at these two silver plans, it's really about the network of doctors you want to choose. So the Premier plan will be a little bit cheaper than the Performance plan because there's less doctors you can see. The same thing with the Gold plan. Now, when you're looking at these plans, I want to just kind of go over some of this terminology so you can understand how these plans work. So at the very top here, we have a deductible. So with the silver plan, it's a $2,400 deductible. A deductible means this is what the insurance company says, we want you to pay all of this number before we start to pay anything. So deductible, the higher the deductible, the more you're paying upfront out of your pocket. The out-of-pocket maximum here, this is the most you would pay no matter what happened. If you went to the hospital and you had $1 million in claims, you're in there for a month, on this silver plan, the most you would pay is $9,200. Okay. Then we get into some of our co-pays. For a regular doctor visit, you'll pay $57. For a specialist, you pay $58. DED waived. When you see DED waived, that means the deductible is waived. That means you do not need to pay $2,400 before you get to pay only $57 to see a doctor. Okay, so DED waived is good news for you. It means you just pay the copay. So if you're on the silver plan and you need to see a regular doctor, you just pay $57 and that's the full price. For a specialist, it's $58. Why are these weird numbers and why are they only $1 apart? I don't know. Insurance companies are weird like that, I guess. Diagnostic lab and x-ray. So for diagnostic labs, this is blood work. You're going to have your deductible waived. You just pay $15. But if you need to get an x-ray, you would have to pay $55 after your deductible. Okay, so if you haven't met your deductible, you pay full price for the x-ray. Same thing for MRIs. After your deductible, you have a copay. Rehabilitation, so physical therapy, occupational therapy, speech therapy, you have a copay. For prescription drugs, you have copays. Emergency room, after your deductible, you have a copay. Urgent care copay. Now, see this 50% here? This, I want to walk you through what this means. So 50% after deductible means if I were to end up in the hospital, say, and it was a $20,000 bill, I would pay 100% of the cost for the first $2,400, and then I pay 50% and Sharp Health Plan pays 50% until everything I've spent in the year equals $9,200. This is my maximum out of pocket. Once I have spent $9,200 on my deductible, on my doctor visits, on my prescription drugs, on my hospital stay, all of it combined. Once I hit my maximum out-of-pocket number of $9,200, Sharp will pay 100% of the cost for the rest of the calendar year. All right. So all the way through December 31st. So a lot of people get scared about this 50%. They think it just means it's 50% of the cost, no matter how big. So it's not that. It's 50%, never to exceed your maximum out of pocket. So these silver plans, very affordable coverage. Lowest prices you're going to see when it comes to what it costs out of your paycheck, but the most out of your pocket when you go to the hospital, you go to the doctor. So for those of you that don't really ever use your health plan, aren't really going to the doctor at all, just want a health insurance plan in case something major catastrophic happens, you are perfect with the silver plans. Very good plans. Now, the gold plans, I'm not going to go through the same example, but the gold plans, deductible is only $250. Your maximum risk, the most you'd ever be out of pocket, is $7,800. Doctor visits are cheaper and the deductible is waived. X-ray and lab deductible waived. There's no deductible for brand name drugs. But most importantly, if you look at your inpatient hospital services and outpatient surgery, it is a flat dollar copay. This means that if I go to the hospital on that same $20,000 problem I had, I'll pay the first $250. That's my deductible, very small. And then I pay just $600 copay for each day I'm in the hospital. So if I'm in there for 2 days, I spend only $1,200. Now, if I'm in there for a month, I pay my $600 copay for the first 5 days only, and then I don't pay anymore after that for that hospital stay. All right. So $600 times 5 is your most. Even if you're in there 7 days or 10 days, you stop paying that copay after day 5. Same thing, surgery, $300 copay. Emergency room, $250 copay. All right. So for those of you that are sitting in the room thinking, well, I do use my health plan a little bit. I do have regular MRIs. I'm going to have a baby. Maybe you do mountain biking or snow skiing, something where you end up in the emergency room. Or maybe you just don't like the idea of having to be on the hook for up to $9,000 for a hospital stay. The gold plan is a really good middle of the road plan. The premiums aren't quite as expensive as platinum. They're a little bit more expensive than silver, but it really manages your out-of-pocket expenses should you end up in the hospital, have a surgery, or go to the emergency room. All right. So for those of you that have predictable medical expenses, that know that you're going to have some out-of-pocket expenses, maybe you have a planned surgery or you're having a baby, make sure you look at these gold plans or the platinum plans, because while yes, they cost more, they will save you thousands of dollars if you go to the hospital or have surgery. On the far right, we have our platinum plan, no deductible, $2,150 maximum out of pocket, very low copays, very inexpensive prescription drugs, only $500 a day for 3 days in the hospital. $100 only for an emergency room visit. So the platinum plan is perfect for those of you that say, I don't have just a little bit of expenses. I have a lot of expenses. I have a lot of prescriptions. I go to the hospital. I'm having a baby. I'm getting MRIs. I have a surgery. I have physical therapy. The platinum plan, again, will cost you the most of all these plans, but your out-of-pocket expenses when you see a doctor, when you go to the hospital, when you get surgery, you can go to the emergency room, will be so much lower. Okay. So those are our 5 medical plans. I'm going to pause real quick. Any questions on any of the terminology we discussed here? Okay, we'll have questions, individual questions for after this as well. And then for those, again, my email, my information was on that first slide, and it's the very last slide. So if you have questions you want to email or call me, you can do that. So those are our medical plans. So let's talk about our dental plan with Principal. So we've got the one dental plan, and it's basically a PPO dental plan. So PPO dental plans means you have lots of choices of who you could see. But our dental plan has even a smaller network called the EPO network. It's already in there. You don't need to do anything different to get it. But on the EPO network, there's about 50 to 60% of the dentists that are in the full PPO network. If you use the EPO network, you have no deductibles for anything. So you see on the PPO in network here in the green, this is our PPO network. For basic and for major, you pay the first $50 out of your pocket. On the EPO, there's no deductibles. Also, when it comes to percentages, so when it comes to preventative care, this plan covers 100% of your preventative care. So this is your cleaning, the bite wing x-rays, the basic 2 times a year preventative exam. Both the PPO in-network and the EPO cover 100%. When it comes to basic services like cavities, like root canals, like periodontal, that's the deep cleaning. If you go to an EPO network dentist, it pays 90% of the cost. You pay 10%. Whereas with the in-network PPO, it's 80% and you pay 20. Same thing with major stuff like crowns, like implants, like oral surgery. With the APO network dentist, you pay only 40%, whereas with the full PPO, you pay 50%. Lastly, both of these plans have a maximum annual benefit. If you're going to EPO dentists, you have $2,000 a year that you get to spend in claims, in your out-of-pocket expenses. In just the PPO network, it's $1,500. So the message here is I want you guys to try to find your dentist in the EPO network. All right. Your money will go further. They pay for a higher percentage of the cost of your services. Your maximum is $500 higher than it is with just the full PPO. So here's the website topprinciple.com, and you're searching the Principal POS plan. When you do that and you put in your zip code, whatever it may be, you're going to land on this page here, and it's going to allow you to choose this button where it's showing you only EPO providers. So if you click this button right here, that means all of these dentists that you're going to see here are EPO network dentists, which means that they will pay a higher percentage, Principal will pay a higher percentage of your costs, and you have a higher maximum benefit. You can also choose to show just a PPO provider. So these are not the EPO providers. So if you're looking for someone specific, you can show just the PPO providers, or you can show all of them. So I don't mean to confuse anybody with all these different things. I just want to help educate you that you can go to the EPO network providers, and there's not going to be quite as many of them, but your dollars will go a lot further with the EPO dentist. If you have a very special dentist to you that's not in the EPO network, but they're part of the PPO network, no problem at all. You still have a very good dental plan, but it's not going to go your dollars don't go quite as far as they would if they were in the EPO network. Any questions on dental? A little bit more information on dental. So Principal has some extra benefits available for employees that might be pregnant. So there's additional periodontal coverage. So that's the deep cleaning. A lot of the sicknesses and illnesses we get as adults start in the mouth, and this is especially important during childbirth or during being pregnant. So additional periodontal care, additional care for those facing cancer treatments. Again, health problems start in the mouth a lot. For any employees who have kids that have autism, Down syndrome, cerebral palsy, muscular dystrophy, there's a general anesthesia program that is available through this. So lots of extra benefits. Principal is a very, very strong dental carrier, and one that I think has a lot of these extra benefits for you. Our vision benefits also through Principal. They use the VSP network. So this is exactly the same as what we've had. So no changes to the dental or the vision program here, just highlighting what we have. So under our vision plan, we have a $10 copay for an eye exam. You get this once every 12 months. There's a $25 copay for lenses. So the actual lenses in your glasses, just a $25 copay once every 12 months. You have that benefit. And then every 2 years, you have an allowance of up to $130 to buy frames. And then you get a 20% discount. If you go over the 130, you get a 20% discount on that as well. So to find a provider, you can go to vsp.com and use the choice network. Also, you could go to principal.com/VSP. It's all going to take you to the same place. So if you need help in identifying a provider that you can go see, two very easy ways to do that. Go to vsp.com or go to principal.com/VSP and search. Any questions on vision? Little extra information here. So lots of locations. You can even use the online shopping feature with Iconic through the VSP network. over 5,500 retail chains. And they even includes reimbursements. If you go to a provider that's not in the VSP network, our vision plan will still reimburse you some amounts to cover some of those costs. This is a new benefit here this year. We started creating what they call these microsites. Gwen, I'll share this information with you as well, but the URL is right there. It's eb3.com/microsite/Printex.
Okay.
This is what I want you guys to consider the first place you go with any benefit questions. When you get this website, I would like to ask all of you to bookmark this so you can get back to it very quickly. There is a ton of information here. So there's lots of information. There's a link right here to our YouTube channel where I've got dozens and dozens of videos, very quick stuff about what's a PPO versus an HMO? How do I choose a health plan? What's a deductible versus out-of-pocket maximum? So lots of good information there. And then every one of these bars here is a little drop down. And like you can see, I opened up the Sharp Plan member resources, and there's all kinds of stuff for here for you. So you've got questions on how to go see a behavioral health doctor, or information about the pediatric dental and vision benefits, or what's covered under your preventative care visit, whether you're a child under the age of 10 years old, or 11 to 17, or a male over 18, or females over 18 years old. There's information on the pharmacy resources. So for those of you taking regular medications, you can apply for mail order pharmacy benefits where they will send you your prescription to your home so you don't have to go to a pharmacy, and you get a 90-day supply for the price of only 60 days. So you get like 30% off doing that. There's family planning resources with Sharp. There's the principal member resources. So for those of you who have questions about dental and vision, lots of resources there. And then our Healthcare Explained drop down. Again, these are just quick hit videos, really good information for those of you that want more information about healthcare and how to understand insurance. And just these are just small, quick videos that I've been doing over the last couple of years that help explain little parts of healthcare. And then as you scroll down, you can't see all of it, but you'll see my information. You'll see all of our staff's information that's available to you all the time. You can reach out to them, as well as the Sharp member information, the principal member information. So this particular site really is built to help answer your questions 24 hours a day, 7 days a week. And then our information is included in there so that if your questions aren't answered here, you can reach out directly to us and we can help you. So enrolling is going to be the same as we've done in years past. We're using the Ease Benefit Enrollment Portal. All of you would have received an email 25 minutes ago through your email inviting you to log in and enroll. The email looks just like this. It says now open, Employee Benefit Enrollment Portal, and it has welcome to your name. Here's, Anna's information here. So if you have any questions, if you have difficulty logging in, reach out to Anna. This little login button right here, you hit that, you'll be taken to this page here, which if you already have logged into this site, you don't even need this email. You can go straight to printex.ease.com and put in your username and password. And I know that's been a year for many of you since you've done this last, so it's fair if you forgot your password. Right here is the forgot button. So if you forgot your password, you can hit the button right here. It'll help you reset your password. And again, if any of you are having trouble with it, if any of you are running into problems, just reach out to us. Let us help you navigate that a little faster. So the next step is looking for that email in your inbox. You're going to then click on it and go through the process. We're asking everybody to do this by next Tuesday, October 14th. If you've got questions on this, if you need answers, we are here from you. I'm going to stay on this call for any of you that have questions that want to ask. I promise you, if you have the question, other people probably have the same question as well. So I'll stick around and answer questions. But for those of you that maybe your questions are private, maybe it's not appropriate in this setting, my phone number and my email address are on the screen. I will leave it there. Feel free to take a picture of it. Feel free to reach out to me throughout the year. We'd love to help you make good decisions. And and help make some sense of a very, very confusing business, and health insurance can be so tough to navigate. So we just want you to know you're not alone in it. So that's the end of my presentation. That's all I got. I will stick around and answer any questions, but for those of you that have all the information you need and you don't have any questions, we're all done here. Just ask that you log into your Ease account and make the elections that you need to make before next Tuesday. So thank you very much. That's all I got. I will stick around and answer any questions you have.
Thank you, Bill. Guys, you have